Hi everyone. Before we proceed to my drug profile, let's review first the importance of the cardiovascular system. When most people heard the term cardiovascular system, they immediately think of the heart. I know we have all felt our own heart pound from time to time, and we tend to get a little bit nervous when that happens. The crucial importance of the heart has been recognized for a very long time. However, the cardiovascular system is much more than just the heart. On scientific and medical standpoint, it is very important to understand why the system is so vital to life. The major function of the cardiovascular system is being a transportation. Using blood as a transport vehicle, this system carries oxygen, nutrients, cell waste, hormones, and other substances that is important to our body's homeostasis to and from the cell. The force that moves the blood around the body is provided by the beating of our own heart. We can also compare cardiovascular system to a muscular pump equipped with a one-way valve and a system of large and small tubes within which the blood travels. So, now that you know the importance of the cardiovascular system, let's proceed to my drug profile.
So, I will now introduce myself. Hi, 안녕하세요. I am Amiodarone, one of the drugs classified as class 3 antiarrhythmics. My brand names are Nexterone and Methanone. My chemical name is 2-butyl 1-benzofuran 3YL 4,2-diethylamino ethoxyl 3,5-diiodophenyl methanone. And remember, I am category D.
Hi everyone, it's me again, and don't be confused because I am still Amiodarone hydrochloride. And I hope you already know my brand names, my chemical name, and my pregnancy category. So now, let's proceed to my drug classification, to my therapeutic one, and to my pharmacologic. So, for my therapeutic, I am an antiarrhythmic drug. Once again, I am an antiarrhythmic drug. And for my pharmacologic, I am a benzofuran derivative. Once again, I am a benzofuran derivative. So, for my mechanism of action, the increase in ARP is the primary mechanism by which the class 3 drugs, such as me, exert their antiarrhythmic effect by making the ARP greater than the conduction time around the reentrant circuit. I am also used to treat life-threatening arrhythmic by which no other drugs have been effective.
I may be taken orally or intravenously, and if administered orally, my onset is 2 to 3 days, peak is 3 to 7 hours, and the duration is 6 to 8 hours. And if I may be administered intravenously, the onset is immediate, peak is 20 minutes, and the duration is the time of the infusion. And my half-life is 10 days, and I am metabolized in the liver and excreted through urine. My plasma concentration are attained 3 to 7 hours after a single dose.
For my indication, I am indicated in three different kind of group of people. First is the children. I am not oftenly used in this kind of group age. Next is the adults. I am indicated for emergency cases. Evaluation of drug regimen should be done carefully and regularly in order to ensure the effectiveness and the patient's safety. And lastly, to the older adults. I am more susceptible to drug toxicity because of the underlying condition that would interfere the metabolism and excretion of drug. Renal and hepatic function should always be monitored.
Always do remember my contraindications because I am contraindicated on patients with overactive thyroid gland, low amount of magnesium in the blood, peripheral neuropathy, those patients with sudden blindness and pain upon moving the eye, complete heart block, slow heartbeat, abnormal functioning of the sinus node of the heart, inflammation in the lungs due to an allergic reaction, those patients with pneumonia with high amount of eosinophil white blood cells, those who have chronic lung disease, liver problems, abnormal liver function, pregnancy, laser surgery on cornea of the eye, thyrotoxicosis, those patients with low thyroid hormone levels, low amount of potassium in the blood, deposits on the eye, optic neuropathy, a disease of the optic nerve, second degree atrioventricular heart block, prolonged QT interval on EKG, a type of inflammation of the lung called interstitial pneumonia, or also a recent operation blood circulation failure due to secretion heart condition, and also those mother who is producing milk and breastfeeding, and fainting from slow heartbeat and bleeding in the alveoli of the lungs.
For my side and adverse effect, in central nervous system, I can cause fatigue, malaise, tremor, peripheral neuropathy, um, ataxia, paresthesia, insomnia, sleep disturbances, headache, and dizziness. For the cardiovascular, I can cause hypotension, asystole, atrial fibrillation, bradycardia, arrhythmic, heart block, sinus arrest, edema, and flushing. For the eye, ear, nose, and throat, I can cause asymptomatic corneal microdeposit, visual disturbances, optic neuropathy resulting in visual impairment, and abnormal smell. For the gastrointestinal, I can cause nausea, vomiting, abnormal taste, anorexia, constipation, abnormal pain, and diarrhea. For the hematologic, I can cause coagulation abnormalities. For the hepatic, I can cause hepatic failure and hepatic dysfunction. For the metabolic, I can cause hypothyroidism and hyperthyroidism. For the respiratory, I can cause severe pulmonary toxicity, pulmonary edema, and eosinophilic pneumonitis. For the skin, I can cause solar dermatitis, blue to gray skin, and photosensitivity. For the others, I can cause in decrease of lipido.
And upon using me, there are responsibilities that the nurse must always remember. First, the nurse must be aware of the high risk of adverse reactions, must obtain baseline pulmonary, liver, and thyroid function test results and baseline chest x-ray. I may cause hyperthyroidism and hypothyroidism. And if this occur, the nurse must reduce the dosage or discontinue using me. And also monitor for thyroid function during treatment, particularly in elderly patients and those underlying thyroid dysfunction. Give loading doses in a hospital setting and with continuous ECG monitoring. I am used only in patients with life-threatening recurrent ventricular arrhythmias, unresponsive to or intolerant of other antiarrhythmics or alternative drugs. Also, the nurse must watch the evidence of pneumonitis, exertional dyspnea, non-productive cough, and pleuritic chest pain. Also, monitor for the correct electrolyte imbalances before giving me to the patient. Monitor LFTs and thyroid function test results and electrolyte levels, particularly in potassium and magnesium. Also, the nurse must instill methylcellulose ophthalmic solution when using me as a therapy to minimize corneal microdeposits. Monitor for the blood pressure and heart rate frequently. Perform continuous ECG monitoring when starting or changing the dosage. And also, the most important, you have to inform the prescriber for a significant changes. The nurse must also conduct patient teachings, which the nurse must advise patient to wear sunscreen or protective clothing to prevent sensitivity reaction to the sun. Monitor patient for skin burning or tingling followed by redness and blistering. Exposed skin may turn blue or gray. Advise patient to keep follow-up appointment including the eye exams and blood test. Also tell the patient to report vision changes, weakness or numbness, poor coordination, weight change, heat or cold intolerance, neck swelling, progressive rash, or mucosal lesions. Also tell the patient to take oral drug with food if GI upset occur. Inform patient that adverse effects of drug are more common at high doses and become more frequent with treatment lasting longer than 6 months but are generally reversible when drug is stopped. Tell patient not to stop taking this medication without consulting the prescriber.